So in this video, I'm going to show 3 ways you can desensitize nerve-related pain in the foot. Just to give a brief summary, there's a lot of different things that can cause nerve pain in the foot. It often has a burning sensation, sometimes tingling, sometimes lightning shock. And it can be a really difficult kind of pain because it's not the same kind of muscle cramp, ache and pain that you can just massage or work out or stretch the way you can any other pain. But there are 3 good techniques that I've found really helpful for relieving this kind of pain. But all these techniques are based around one principle, and that's you don't want to do anything that triggers too much pain. The first thing you're going to do is you're going to imagine you have a little line here. This is your pain. So if this is 0 out of 10, meaning you have no pain at all, and then this is 10 out of 10, meaning you're basically feeling like you're dying, you want to ask yourself, where is your pain on the scale right now? And for the sake of this, let's say it's a 5 right now, but whatever your pain is your pain. Then the second thing you got to ask yourself is, whenever you're doing any of these exercises, how bad does your pain get? And the number 1 rule with this is you never want your pain to become any more than 2 points higher than what it was to begin with. So that means that if your pain started off at a 5, you never want to do any of these exercises or techniques to bring it above a 7 at all for any of these. This is a little different than many of the traditional exercises I've shown in the past. Now, once you know that number, the first thing we're going to do is desensitization using some kind of a texture. Basically what I would do is I would start off by grabbing just any old Kleenex, nothing too fancy, and imagining where your pain is on your foot. So let's say the pain is on the inside of my foot right here. What I'm going to do is I'm just going to take the Kleenex and I'm just going to rub it up and down wherever that pain is there. And you should know right away whether this is setting you on fire, whether it's bringing you up higher than 2 points from where you started or not. You should never feel that. If it brings it from, let's say, a 5 out of 10 to a 6 out of 10, that's perfectly fine. Just keep going, make sure it doesn't ever reach a 7. If it does, I would lighten up on the pressure. Usually a Kleenex is a pretty safe one to start off with. But one other thing you can try too, if you feel this isn't giving you any even slight increase in your pain, is you can step it up to something like a dishcloth. Any kind of dishcloth you use to do the dishes will work. And you're just going to take this and rub it up and down along that area as well. Exact same idea. I would do this for about 2 minutes at a time. And as always, make sure it doesn't go above that 2 points out of 10 higher than what it was. As soon as you feel that, stop, and keep track of this as well. You want to have an idea of how much you can handle so you don't end up going over the top too much. One good in-between surface you can use is your t-shirt, which is not quite as rough. I have seen some people even use the carpet and just kind of drag their foot against the carpet. You can also make it harder by basically pressing harder and then going up that way. It's almost as if you're giving your foot a good scrub. And if you do want to make it easier, obviously you can take the pressure off as well. So you want to find the right amount that works for you for this. Big idea with this is you're slowly helping those nerves adapt to decrease that sensation of pain that you will feel. And the second thing I'm going to touch on is the exercise part. Now, the most basic way around this for most people is just to do this with walking. So I'm going to explain that way first. Basically, just start doing laps around your house, start walking the way you normally do at a comfortable pace. Grab yourself a timer and then go in a comfortable pace. And time how long it would take you before you start to feel that your pain increases 2 out of 10 more than what it was at first. So you basically want to do that as long as you can. If you are at the point where you literally feel you can do it all day, I would recommend selecting a different exercise. And if it does feel too painful to walk, I'll show you an alternative right after this as well. But basically you want to count however much time that is to do that entire routine. And then as soon as you feel the pain go up 2 out of 10 points higher, remember that time, cut that time in half, and that time will be the amount of time that you walk for during this exercise. So one example is if I walked for 10 minutes before my pain went from 5 out of 10 to 7 out of 10, then I would know that I would need to walk for 5 minutes at a time and then stop. This can even be a good way if you are getting a lot of pain throughout the day to kind of pace your day up so you're not overdoing things that flare your pain up too high. And for those of you who find walking too easy, just come up on your tippy toes doing the old calf raise and follow the exact same thing, do as long as you can before the pain comes on. For those of you who find it too hard to walk on the feet, you can instead just sit down and just raise your feet up and then bring them down like that. You're basically rolling onto your heels, then your toes, then your heels, then your toes. I will say you can be creative with this if you do want to add any other exercise or activity that's normal, but the big rule is you don't want to ever bring your pain more than 2 out of 10 above where it was, and you want to do half the time it would take to bring it to that point to start. Now to make this harder, you can gradually add a little bit more. One reasonable way to progress this is every 2 to 3 days you can add about 10% onto the time. So it's ultimately a constant guess and check to see, but the big thing is you don't want to get yourself above that pain, so you kind of want to gradually work your way up. Now the third desensitization exercise actually requires another person. I was trying to see if I could find any way to do this solo, but unfortunately you usually need another hand. And all you're going to do here is you're going to have somebody touch any random spot on your foot or anywhere kind of near-ish where the pain is, and they're going to put their finger basically on that spot there. They don't have to push it really hard, but they're going to put it there. And what you're going to do, so imagine this is my friend's finger and this is my finger. You're going to, as soon as they put their finger down and then take it away, you're going to put your finger on that exact same spot. The big idea is that if, I'll make this marker the finger, for example, if I was to point right here, if my friend was to point right here, I would want to point right on top of that area, right on the target. If I don't go right on the target and I go a little further, it often shows there's a bit of a disconnect between the brain and the nerves to the feet. So you really want to work on getting that accuracy. They have shown a lot to say that this can help with pain relief. So how this would work in practice is you'd get a friend here to put their hand on your feet, and then you would put your hand in that area. Of course, when you're doing this, you are going to have your eyes closed because you want to be able to make this purely a sensory experience. But your friend would go here, and then you would try to go to there, then your friend would go here, you would try to go there, and they keep basically picking random spots, and you got to try to follow them. Now this is the type of thing I'd probably do for about 2 minutes at a time, and obviously you're probably limited to how many you can do by how often or how willing your companion is to do this with you. And the last point I'm going to talk about is how often should you do these? How many sets a day should you do? The one thing is, because this is trying to build the nervous system and it's not a muscle building kind of thing, and because this is a low risk activity, I would say as much as you can get away with, go ahead and do this. As long as your pain doesn't go up, you can literally do this all day, every day. The nervous system really does love repetition, so the more you can do those things, the more you can kind of get it used to everything, the quicker things will recover, and ultimately the better you'll feel. This is also something you do want to try to work into your daily routine. So even if that means just rubbing your foot against your pant leg, rubbing it against the carpet, even going for little walks through the day and then just kind of knowing when to stop. You can find many ways to be creative with this, but the big idea is eventually you're going to calm down your nervous system, make your pain settle down, and help you feel better in the long run.